Naturopathic medicine is a system of health care that uses modern science and traditional natural approaches to care.
The traditional scope of naturopathic medicine, it's really great to work with the patient and their own body and find what's missing and add that in, and just having the ability to actually take time with the patient to make those connections, figure out who they are, to get a full picture. The University of Western States was unique to me, and I chose it because it has the informed evidence of practice.
We learn about people, we learn about their life skills, we learn about their behaviors. And when you're working with patients, that's an important piece. Most commonly, our students become clinicians working as primary care physicians, or they'll specialize in different areas such as women's health. Others become instructors or teachers in schools, or they will become researchers. For a university to be especially one as specialized as the University of Western States, it says a lot about what the university's attention is to, what the students need and want as they move through the program. And so they're constantly revising to address those issues. But more than that, I think it also says something about its attention to the needs of the community. And I think they've done a great balance of both of those things.